Hello. So I talked about a little bit on Alzheimer's disease last time, and I want to continue talking about it. There are a number of things which are happening, and we talked about basically Alzheimer's is a memory loss where certain abnormal proteins get accumulated, from tau protein to amyloid deposited, and these can be detected by specialized PET scans. So there is some improvement in the diagnostic ability to diagnose Alzheimer's. It appears to me from my review that if we diagnose Alzheimer's at an earlier age of the disease, not necessarily the earlier age of the patient, then certain treatment modalities might be effective. Once you are lost the neurons and memory loss is significant, then adding medication may halt the rapid progression or at least reduce the rate of decline, but may not reverse back any process. I'd mentioned a couple of things which are important. One is the slow wave sleep, which is the deep sleep during which we do not have any dreams. Basically, it's an absence of anything related to mind, intellect, ego, and it's just a deep sleep where there is a slow wave activity of the brain. And during that time, it appears that flushing of bad protein occurs. So having an adequate deep sleep is very important. The question in my mind would be if there are drugs, and there are drugs which increase slow wave sleep, would they improve the Alzheimer's condition in early stages? I don't have the answer. Second thing was this. Other things which have been tried, like the LED light flashing 40 per second, etc., they were effective in mice. Some studies are going on. Hopefully, we'll have something to do that, and that may also help to retain the memory. Couple of simple things that I want to talk to you today about, though, is very simple. The two studies that were done, which were based on Framingham study, which was a big study. The groups were, of course, smaller, and some groups were followed for 17 years, 30 years, that kind of stuff. So when they found out that HDL protein, or lipoprotein, high density lipoprotein is the full form for HDL. H is high, D is density, L is lipoprotein. They found out that for group between 35 to 50 and then 50 to 60 or 65, the effectiveness of increased HDL as a preventive mechanism for development of Alzheimer's disease was there. So for every 15 milligram increase in HDL value, there was a reduction in almost 15%, maybe 14.7% in the age group 35 to 50, and about 16% or so in the age group higher, 50 to 60. So certainly an HDL seemed to carry at least the correlation, if not the cause and effect type of things. So it appears that increased HDL is protective. So the HDL protein, if it is better by 15 milligram, then you have a less chance of developing Alzheimer's disease. And this held true for groups from 35 to 50 and then 50 plus, which is middle age, at least for the study purpose. Again, the question that would arise is that if somebody has a low HDL, say somebody has HDL of 40 instead of 55 or 60, which is supposed to be normal, would using the drugs exercise that kind of mechanism, increasing HDL, would it prevent Alzheimer's? And of course, the jury is out. I'm not sure there are any studies right now that I know of where they studied a group of people who had low HDL, were given medicines or other means. Their HDL went up, and that group compared to the group that was not given medicine or exercise program had a less risk of Alzheimer's disease. But certainly, it appears to me that it may be correlation or coexistence, or there may be a direct relationship, though we don't know the mechanism of action. The same thing holds true about glucose. So as you can see, we are falling back on bad stuff in the blood: hyperlipidemia, increased lipids, hyperglycemia, increased sugar, diabetes. For 10 milligram increase in the glucose, there was an increased incidence of Alzheimer's disease in the same age group that I just mentioned. So again, we're not sure if they were diabetic or not, but certainly those people who had increase in their middle age, from their early age to their middle age, the glucose went up, they had a higher risk of developing Alzheimer's. Again, whether it is because they have become pre-diabetic or so-called hyperglycemia, and that itself is like acting like a diabetes, which may have a vascular component, and that could be leading to Alzheimer's disease. But for sure, from 35 to 50, 50 to 60 or 65, if your glucose increases in the middle age group, the middle one, 50 plus, compared to when you were 35, then you have an increased incidence of Alzheimer's disease. So it appears to me that having a increase in the good or protective HDL protein reduces the risk of Alzheimer's. Having an increase in glucose, which is like a diagnosis of pre-diabetic or so, may have increased risk of Alzheimer's disease. The triglycerides, on the other hand, didn't seem to be much. And remember, these people were matched for other components. There was some correlation between the increase in diastolic blood pressure and the risk of Alzheimer's. Again, as you can imagine, all these things, whether it is the lipoprotein or the fat component, lipo stands for fat, or the glucose, which is for diabetes, or the blood pressure, these three things indirectly cause, most likely, hardening of the arteries, and that may be contributing to it. There's an interesting thought which was expressed several years ago about diabetes and the vascular component, whether there are two separate genes which affect the vascular components of diabetes or not. Because people who get repeated infection or inflammation of pancreas from, say, alcohol ingestion called pancreatitis, they also can develop diabetes, but their diabetes is not usually associated with vascular complications, which is seen with patients who are born diabetic or develop type 2 diabetes as an adult without pancreatitis. So it's possible that the two genes are awfully close and they're transferred simultaneously, or there is a diabetic gene, vascular gene, or there is only a diabetic gene, but because of uncontrolled sugar, it accelerates the process of atherosclerosis, which leads to hardening of the arteries, and that leads to the dementia or Alzheimer's disease. Nowadays, we are doing lots of genetics, and so we have some genes or genetic analysis which is being done nowadays, and this genetic analysis is not 100% test, but certainly that one that can tell you whether there is a preponderance or there is a likelihood of having a Alzheimer's disease. Another neurological degenerative disease is called Parkinson's disease. The gene called LRRL2, I will repeat it, LRRK2 is associated with development of Parkinson's disease at a higher risk. And the other one, which is thought to be genetically related for Alzheimer's, is APOE4. So some people are trying to get analysis done and see if they have that gene and then maybe treat it earlier. Again, since we don't know much about the treatment part in the earlier stages of the disease, I'm not sure how effective that is, but I'm sure that we will have medication that will be effective in the early part of the disease, or if started early, we will be successful. Thank you for watching. I hope you like it and subscribe. Have a nice day.